visceral pericardium, or the epicardium, is the external covering of the heart. On the posterior side, we have the base and then the apex of the heart. We have the right atrium here and the left atrium on this side. And up top we have the auricles, which help increase atrial volume. So here is the right, it has an incision through it, but you can see it here, and the left. The right ventricle is here, and the left ventricle is here. We have the interventricular sulcus, which is fatty lined right here. A couple arteries that run in that area. We have the anterior interventricular artery that runs this direction, and then over here we have the coronary artery. The pulmonary trunk can be found here. The aorta can be found here. Get my finger in there. Right here. The ascending aorta would extend from this hole out through the top, and that has 3 arteries that extend from it. The brachiocephalic, carotid, and subclavian artery. The superior vena cava is hard to see here. It's the same with the inferior vena cava because they were clipped. You can see it here. And then the inferior would extend down this side. The coronary sinus is on the posterior side. It can be seen here. And it runs across the coronary sulcus. Okay, now if we go inside, let's see what we can see. So if we go on this side, we can see the pectinate muscle on the outside here, and the myocardium is better seen on the left side here. Right here, this pink piece. And it's 3 times thicker on the left side because of the pressure needed to pump blood to the aorta. The trabeculae carnae are the arm-like fibers of muscle, which you can see just inside here. We have the interventricular septum, which is difficult to see when you don't have a fully cut heart, but it's in here and it divides the ventricles. The bicuspid valve was severed when you cut it, but you can see the pieces of it right here, which connected over here. And the tricuspid valve is on this side, and same issue with the cut. It's difficult to see it connected, but we've got one piece here and the second piece here that connected. The chordae tendineae are the pieces that actually, the fibrous, let's see if we can show on this side, the pieces that actually form the valves, those stringy pieces right there. Those are the chordae tendineae. The cusps of the valve are difficult to see also. Let's see if we can get some light up in that hole. Yeah, the cusps of the valve, they're divided into 2s or 3s. The papillary muscle is actually where the bicuspid valve inserts. I'll show it on this side. You can see the pieces of muscle where it inserts. Those are the papillary muscle. And then the pulmonary semilunar valve. So that inserts into the pulmonary. Just on the inside of the structure here. And then the aortic semilunar valve, again, into the dark abyss right in here. You can see a bit of it.